Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to co-found SPT with Me, which is an online NPTE study platform. If you end up enjoying this video and feel it was beneficial, please check out our courses at sptwithme.com for our full NPTE studying experience, designed to guide you toward acing your test. Now on to what you're actually here for. Let's talk about adhesive capsulitis. Adhesive capsulitis, also known as frozen shoulder, occurs specifically at the glenohumeral joint. What happens is that the joint capsule of the glenohumeral joint, it gets inflamed, it gets progressively fibrotic, and it results in contracture. So essentially, the joint is irritated, it's tight, and it's stiff. Some key identifiers. Multiplanar symptoms. Unlike other shoulder diagnoses that may present with impairments in just one or two planes, adhesive capsulitis affects the entire joint capsule. As a result, all motions in all planes, not just one or two, they are all affected. So think about abduction, flexion, external and internal rotation, scaption, etc. They are all limited. Given that frozen shoulder is an issue with the joint capsule, we should also consider capsular patterns. The capsular pattern for the shoulder joint is, from most to least affected, external rotation, abduction, and internal rotation. Passive range of motion versus active range of motion. In adhesive capsulitis, the joint capsule is tight regardless of the presence or absence of muscle contraction. So whether your patient actively lifts their arm or you as a physical therapist lifts your patient's arm passively, the capsule is going to remain stiff and will limit the range of motion. Therefore, both passive and active range of motion are limited with those who have frozen shoulder. This is an objective finding that can really help you decipher whether the shoulder pathology is muscular or capsular in nature. Risk factors and etiology. Adhesive capsulitis may be triggered by trauma to the shoulder or a surgery at the shoulder that's associated with a long period of immobility. Some risk factors include being female, being over 45 years old, having diabetes, and hypothyroidism, among others. Depending on what source you choose to look at, there are 3 to 4 stages of adhesive capsulitis. Choose PT by the APTA, they identify 4 stages. This includes what's on the screen: pre-freezing, freezing, frozen, and thawing. Luckily, the names really help with explaining what we can expect from each phase. Now, because every person presents differently, these phases are suggested to occur in a general time frame range. So according to ChoosePT.com, pre-freezing can last between 1 to 3 months, freezing between 3 to 9 months, frozen between 9 to 14 months, and thawing between 12 to 15 months. Again, there are other sources out there aside from just ChoosePT, and these might suggest different timeframes. So to give an example, AAOS, they propose that the thawing phase may take up to 2 years. Let's go on to signs and symptoms. These can change gradually as the condition progresses. So in the pre-freezing phase, your patient's primary complaint may be more of pain rather than a noticeable limitation in range of motion, since the effect of the fibrotic changes that we expect with this diagnosis that's in the capsule, it has not yet come into play. Then we go to the next stage, the freezing stage. Your patient might start to notice that now they're having more difficulty reaching for items, taking a shower, maybe donning clothes, among other functional activities. So this is when the pathological process of that fibrotic change begins to take noticeable effect. Then on to the next stage, the frozen stage. If you think about adhesive capsulitis, their signs and symptoms on a graph, the frozen stage, this is at the peak. This is where the pain experienced and the range of motion limitations are at its worst. Then lastly, we have the thawing phase. The inflammation starts to go down, the joint capsule begins to return to its previous state. So as a result, a person's range of motion begins to increase and pain subsides. Physical therapy treatments for adhesive capsulitis. Improving or at least maintaining range of motion at the shoulder joint is one of the main goals for management from us. Given the capsular involvement, it should make sense that joint mobilizations performed at the glenohumeral joint would be one of the interventions that we employ. However, a general consensus as to what grade of joint mobilization, whether it's high versus low grade mobilization, which one is most effective has yet to be reached. So it really just depends on what source you reach out to look for your information. So in addition to joint mobs, there are other treatments that are suggested to benefit. In the references at the end of this presentation, you can take a look at the CPG by Keller et al. To see the effective treatments like corticosteroid injections, stretching, PNF, modalities like ice and TENS, etc. When learning as a student physical therapist, it can be very easy to forget that all conditions, not just this, they all have stages. With adhesive capsulitis, a person might not immediately present with severe external rotation and abduction, range of motion deficits, whether it's active or passive, right? They might not present with an extremely hypomobile joint when you're assessing at your initial evaluation. If anything, your patient might just be at that stage in their condition where they just don't present with any range of motion deficits at all. They're in their early stage of that condition. So considering this is why it's very, very important to be knowledgeable about other aspects of the condition, like the population that it most affects, the age range that it's often seen in, mechanism of injury if there is any, among others. I truly, truly hope that this video was helpful to you. I hope this made frozen shoulder adhesive capsulitis more manageable and it put some concepts together to make more sense. Again, I instruct the courses on sptwithme.com. We have more than 6 hours worth of content that is specifically designed to get you to pass and potentially ace your NPTE just like I did. Please leave comments below with questions, feedback. Everything is appreciated. Stay on the lookout for more videos by subscribing. Lastly, here are the references that I used. Please look at any and all of them. They all provide very insightful information on this topic.